My name is Elliot Denny. I am the current chief resident. I'm a PGY4 in the APCP training track. Through the years, through whatever we do in our recruiting, it tends to just pull in just smart, curious, collegial people. And I feel like that's the largest draw of Vanderbilt.
Hi, I'm Alex Perez. I'm one of the new first-year residents here.
My name is Megan Smith. I'm a PGY1 here at Vanderbilt University Medical Center.
I'm Sarah Fitzlaff. I'm a first-year resident this year.
So my name is Brent Sterling. I'm a third-year resident and the associate chief resident.
My name is Jonathan Tucci. I am a second-year resident, APCP here at Vandy. Not only do we have the main hospital here in which you do the majority of your rotations, but we also have the VA campus in which you get a different surgical pathology experience. You get the general sign-out instead of a subspecialty sign-out. Really prepares you for what it's like, especially if you're interested in private practice, on how that would be. And you see just the different types of cases as well. We have the Children's Hospital, you have the Peds Path rotation, and so you actually learn dedicated pediatric pathology. And then we have the offsite 100 Oaks, which has its own setup for cytogenetics and dermatology. So all of that as well was such a great attraction for Vandy. It was just so broad and diverse, and just really I felt would add to my education.
We see just very, very interesting, unusual cases due to the nature of Vanderbilt being a referral center.
The Surg Path sign-out room is an area that is kind of a community sign-out, so people of all different subspecialties are signing out there all day. Slides are kind of being passed around different scopes. People are always interested to show cases.
I don't know what field I want to do yet, but I'm definitely interested in academics and teaching, and I think that's one of the really great things about Vanderbilt is there's a good relationship with the medical school and chances to get involved with teaching and mentoring.
It's no trouble at all to get involved in research. I'm already getting myself in some projects in just the first couple months I've been here, and everyone's been so willing to take a resident on to add them to some of the projects they're working on.
Residents are very willing to help out the lower level residents because we know it's difficult to learn, and really some of the best teaching comes from your upper level residents and fellows who maybe took extra time to teach you cases, go over difficult unknown conferences, or teach you the workflow on a difficult rotation.
Even if there's a lull during the day, the residents were always opening up some document or some book to kind of cover a topic, and they never had any hesitation to try to teach the first years that are with them.
The thing about Vanderbilt is just you're in a very supportive environment, and people care about you outside of just what you can do at work.
Whether it's a question about pathology or just about life as a resident or about life as a person, all of the attendings have been very approachable, and I've never felt uncomfortable asking any questions here.
One thing that in coming up as a first, second, and third year that I noticed and that I've grown to appreciate even more as the chief resident is how much value and stock the program holds in resident feedback. It's just a constant weekly update on the status of the program and how we can change things and how we can kind of maneuver the ship of the residency program.